There are growing fears Tasmania's health system will crack under the weight of massive budget cuts being forced on hospitals and community services. The ABC has obtained leaked budget documents which reveal the extent of cuts to operational units within the health department. Unions say the health system won't be able to cope and lives will be put at risk.
It's the latest blow for a health system already struggling to cope. Leaked documents show where $110 million in cuts are likely to be made across hospitals, ambulance and community services. The Royal Hobart Hospital, which blew its budget by $30 million last financial year, is expected to find $38.5 million in savings. The Launceston General Hospital needs to slash more than $16 million, while at the North West Regional, $11 million needs to be cut. Unions say it's an impossible ask.
We cannot keep on running the whole health system with these sorts of magnitude of cuts.
What's being discussed here and what's being foreshadowed is essentially the equivalent of closing down one of the major hospitals in Tasmania.
The documents show the state's primary health services, which include community health centres, need to shed $8.6 million, while mental health services have to find $7 million in savings. Ambulance Tasmania has been told to cut its budget by $2.5 million, despite initially being given a figure of $1 million.
There is no doubt that a budget cut in the ambulance service of that nature will put lives at jeopardy.
A progress report on the Health Department's budget savings lists limiting the use of locum doctors and nurses and reducing staff overtime. The Health Minister says the cuts have to be made.
This is going to be a very difficult process to move through. What we need to do is ensure that the patient is at the centre of every decision that we make.
The full extent of the health cuts are expected to be confirmed by the end of the month. Tamara Glumac, ABC News.